So thank you for joining us today for the annual general meeting. So as Patty mentioned, I'm Karen Riddell. I'm the acting president and CEO, filling in while David is on secondment at London Health Sciences. So I'm very honored to present to you today the report for fiscal 23-24. So this year has been a real testament to the strength and resilience of our team. We navigated significant challenges, but we also celebrated many noteworthy achievements. And I'm proud to share some of that journey for you because we would be here well into next week if we covered all of the details. So as everybody is aware, we faced a regional criminal cyber attack this past year that really tested our systems. But we also, on the other hand, at the tail end of that, achieved stellar results, receiving exemplary standing designation from Accreditation Canada. And that's the second consecutive time that our teams have received that recognition. So that was a real win on the tail end of our Code Grey. So what I do want to focus on tonight is just the highlights from our past year. I don't want to focus on the Code Grey. We'll hear enough about that over the course of the next number of months. So what Windsor Regional has been able to do this year, we've introduced several sophisticated technologies that enhance patient care. Our surgical teams, for example, implemented an endoscopic ultrasound machine, which is one of the most sensitive methods available for staging both cancer and benign disease. And we performed over 88 procedures already by the end of 23-24. So we're looking forward to doing many more of those in this fiscal year. In addition, we required an ENT navigation system, so ear, nose, and throat, that significantly improves the accuracy and efficiency of our surgeries. Our Windsor Surgical Center also performed over 4,000 cataract procedures, providing crucial eye care to our patients. Our diagnostic imaging teams installed new 3D mammography units, a new 3T MRI scanner at the Met campus, upgraded 3 nuclear medicine cameras, and improved our PACS and SIVA systems, which is how we do our image storage. Thanks to our provincial government support, we expanded our pediatric diversion program operating hours to 7 afternoons per week. We've diverted over 1,300 pediatric patients from our emergency department and we complete over 100 follow-up appointments each month for those children. Our medicine teams have launched a senior-friendly initiative that includes a polypharmacy project, an antibiotic stewardship program, and has formed a mobility committee. They've also reduced iron infusion wait times by 50%. I think that had something to do with Dr. Saad's prescribing habits also. But anyway, we'll move on. And also integrated an ED pharmacist into our code stroke response team, improving our door-to-needle time for stroke treatment. That wasn't too easy. I couldn't avoid it. We also initiated new strategic partnerships with our community partners. We launched our nurse police team this past year, where our emergency department nurses, mental health nurses collaborate with our Windsor Police Service members to address addictions and mental health crises in the community. And this program has prevented hundreds of emergency department visits by providing care and support to our patients in the community and has garnered not only local and provincial attention, but also international attention. We've also partnered with the Windsor Family Health Team to introduce an award-winning oral health program for our inpatient mental health patients. That initiative has significantly improved oral health, facilitated early cancer detection, and really established a new standard for care for our patients. Our patient and family advisory committees, comprising over 50 members now, have led numerous improvements, including the development of a NICU peer support program, the planning of a successful preemie clinic event, as well as providing important feedback on virtual care adoption, many policies and procedures, service recovery for patients, just to name a few. They are very, very busy. They are providing us with so much valuable feedback and really changing how we do service provision at the hospital. So we really appreciate the amount of time that they spend to help support us. With substantial support from the provincial government, we've implemented a third MRI, I should say, as a trailer right now, but we are moving ahead with installation of the actual third funded MRI in September of this year. And then we will be replacing our other MRI at the Olette site with a brand new 3T. In addition to the new MRI installations, of course, you'll have probably all seen, if you drove down Kildare, the construction of our 4th LINAC that started. And of course, with the announcement in this past week, we are moving forward with the construction of our new cath lab at the Olette campus. So we've been waiting for that for many, many years, as everyone knows. Our Windsor Regional Hospital Foundation and our Cancer Center Foundation have contributed millions of dollars towards much of our new technology and patient care equipment. I just want to highlight, these are just a few of the things that we've been able to buy with the foundation's support over the past year, including cinema vision for our MRI suites. And if anybody's had an MRI and knows what it's like to be inside one, these are like goggles, so kids and adults alike can watch movies and other things while they're in the MRI and be distracted from not only the racket that's going on in there, although it's a lot quieter now with the new technology, but also are distracted for longer exams. We've purchased new equipment for our NICU and other vital resources, such as software we need for radiation treatment, patient beds, and of course, funding support for not only research, but education. We've continued our focus on creating a dynamic workplace culture through initiatives such as our Evolved Security technology that we've implemented in our emergency department for detecting threat of weapons. And we've expanded our workplace wellness program that offers emotional, spiritual, and physical activity opportunities throughout the community for both our staff and their families. We continue to benefit from provincial programs such as the Community Commitment Program for Nurses, the SPAP, or Supervised Practice Experience Program, and the Windsor Regional Extern, well, it's not the Windsor Regional Program, it's a provincial one now, but there is an extern program provincially. And this has helped us address recruitment and retention, both with nursing as well as other allied health professionals. And just a little plug from a nursing perspective, because we've been using these initiatives longest, is we're under a 5% vacancy rate with nursing. And that is a historic, I don't think it's been less than 5% since I started. What about you, Rosemary? You've been here longer than me, so. Has it ever been less than 5%? I don't think so. We've also expanded our research footprint very significantly over the last couple of years in particular. We currently, and you might not realize this, we have 123 active research projects on the go at Windsor Regional Hospital. We've received over 13 grants and awards in the past year and had 15 publications. There's been significant progress and a lot of really hard work that's gone into the research office and the amount of research that's going on and the academic focus of our professional staff and our employees in the hospital. So that's something to be really proud of, I think, for our community. And it's really put us on the map, I think, with regards to the work that we're doing here. I won't reiterate what we've been talking about a lot lately, but of course we're going to continue on with the work of our new hospital project. We made a lot of progress over the past year, and we've built many strong partnerships with our First Nation and Indigenous communities to ensure that that hospital is a welcoming and safe place for our patients and visitors. So all that being said, you might ask what's in store for this coming year. So we have lots of exciting projects and advancement on the horizon. Some of you will have participated in our strategic planning that we started just in June. So we've had two very successful events where we did our initial review of our mission, vision, values, completed the SWOT analysis, and now we're in the process of working on our strategic directions and initiatives, and we'll be presenting that to the board in September. We're going to be continuing, obviously, a lot of work with Brandon and his team on the new Windsor Essex Acute Care Hospital project, and we'll be kicking off, hopefully in September, our new cath lab project and starting the installation of our MRI unit at the Olette site. We're also working on implementing a centralized intake system and developing our local stem cell transplant program, and continuing, of course, to expand our research initiatives and strengthening collaborations with regional and provincial partners. Take a breath. So all this work, moves forward thanks in no small part to the generous financial contributions of many of our supporters. So I do want to thank the Windsor Regional Hospital Auxiliary for their ongoing commitment to supporting us. Much appreciated. Not only managing our Met Campus gift shop and supporting the operations of our Olette Campus gift shop, but we are very grateful for their efforts. And I think just a little later in the agenda, we'll have our much needed check contribution. So do want to thank you ahead of time for that. In addition, I want to thank our Windsor Regional Hospital Foundation and the Windsor Cancer Center Foundation, our partners that work with our community to help raise vital funds that we need to support medical equipment, research advancement, and staff education. So I'd like to thank both the foundations as well as our donors in the community who support them and us for our needs today and tomorrow. Of course, none of our achievements or goals for this year would be possible without our employees and professional staff, our board members, and the community. And I'd like to extend my deepest gratitude to our employees and professional staff for their resilience, dedication, and exceptional care, our board members for their strategic guidance and support, our community for their trust and engagement with Windsor Regional Hospital. And he's going to miss it because I saw he was here. I thought I better include something. I actually had it in before I knew he was coming. But lastly, to our past president and CEO, because 23-24 was still, of course, under his leadership. So I would be remiss not to thank David Mouget for leading our organization through a very challenging and also successful 23-24. And also having the confidence and trust in me to temporarily take over the helm as he supports our regional partner, London Health Sciences. So that being said, we look forward to another year of growth and achievement as we continue to strive for our vision of outstanding care, no exceptions, and our mission to provide quality, person-centered healthcare services to our community. Thank you.